Hello everyone. In this session, we are going to discuss a very important topic, that is sickle cell anemia. Very important for long question, but from the short question also, usually the pathogenesis is asked, the factors determining the sickling, clinical features, screening test and diagnostic test can be asked for short question also. So important for long question as well as for short question. Sickle cell anemia. So first of all, have a look on the overview. If it is coming for a long question, you have to frame your answer under these headings. So learn the overview, because whenever this coming as a long question, you don't start writing like a paragraph. First frame your answer under the headings, under these headings, then start writing it in your university exam if you want to get a gold or distinction. So first of all, I will let you know the various types of hemoglobin present in human. There are three types of hemoglobin present in human. I will let you know which three types, where the diagram, their formula and all. Then we will see various types of hemoglobinopathies. The two types of hemoglobinopathies are qualitative and quantitative. One of them is sickle cell anemia. Then we will start the topic sickle cell anemia. In sickle cell anemia, I will let you know the introduction. What is sickle cell anemia? The most important and difficult to understand, but it's conceptual, is the pathogenesis. Why does it occur? What is sickle cell anemia and why does it occur? How does it occur? What are the consequences of sickling? What are the factors determining the sickling? What are the clinical features? Does the patient having sickle cell anemia are protected against malaria? Why? If yes, why? What is the reason? What is the screening test? What is the diagnostic test? So you have to write down everything about sickle cell anemia. So let's start it. Here you can see in humans, there are three types of hemoglobin. What are the three types of hemoglobin present in humans? Adult hemoglobin, fetal hemoglobin and minor hemoglobin. You can see these are the three types of hemoglobin present in humans. Adult hemoglobin, the formula is alpha 2 beta 2. The formula is alpha 2 beta 2. Here you can see two alpha chains and two beta chains are there. The fetal hemoglobin is alpha 2 gamma 2. Alpha 2 gamma 2. Here you can see. So two alpha and two gamma are present. Here you can see two alpha and two gamma are present. And minor hemoglobin is hemoglobin A2. Here it's alpha 2 delta 2. Its formula is 2 alpha chain and delta chain. So first learn the three type of hemoglobin present in human. So adult hemoglobin is alpha 2 beta 2. Fetal hemoglobin is alpha 2 gamma 2. And hemoglobin A2, that is minor hemoglobin, is alpha 2 delta 2. So these are the three type of hemoglobin. What is the percentage, in how much percentage which hemoglobin is present in an adult human body? So in all the healthy adult human body, hemoglobin A is maximum. It's 95 to 98%. It is the major hemoglobin. Fetal hemoglobin is nearly 1% or less than 1%. Minor hemoglobin is less than 3.5%. So these are the types of hemoglobins present in adult human. Now there are two types of diseases related to the hemoglobin, which are known as hemoglobinopathies. Hemoglobinopathies are the diseases related to hemoglobin. Now there can be two types of diseases related to hemoglobin. Either the quality of hemoglobin is not good or the quantity is less. So qualitative disorder or quantitative disorder. Qualitative disorder, here the quality of hemoglobin is not good. I mean, there is some structural abnormality in the hemoglobin. So that is qualitative disorders. And in quantitative disorders, the quality is good. Structurally, they are absolutely normal, but their quantity is less. Their quantity is less. So we will discuss two disorders. Qualitative disorder is sickle cell anemia that we are going to discuss in this session, and quantitative disorder is thalassemia. So there is a separate session on thalassemia. I advise you after this session you should watch thalassemia also. So these are the two type of hemoglobinopathies. Now here we are going to discuss sickle cell anemia. So what we have learned? We have learned hemoglobin. We have learned the three types of hemoglobin in human. Hemoglobin A, the adult hemoglobin. Hemoglobin A2, the minor hemoglobin, and hemoglobin F. We have learned their formulas. Hemoglobin A is alpha 2, beta 2. The main hemoglobin 98%. The minor hemoglobin is alpha 2, delta 2. And fetal hemoglobin is alpha 2, gamma 2. Now we have learned that hemoglobin have two type of disorders. Either the quality is not good or the quantity is less. So qualitative disorder is sickle cell anemia, which we are going to discuss now. And quantitative disorder, in which the quantity is less, is thalassemia. So there is a separate video on thalassemia. Now let's start sickle cell anemia. What is sickle cell anemia? Sickle cell anemia is an autosomal recessive disorder. Please learn the inheritance. It's the autosomal recessive disorder. It's hereditary. It's autosomal recessive disorder. It will be expressed when the person have homozygous state. When heterozygous state is present, it's sickle cell trait, not anemia. If we say sickle cell anemia, I mean homozygous trait. So what is the problem here? I told you the three type of hemoglobin. What is the major hemoglobin? The major hemoglobin is alpha 2 beta 2, and that the name of this hemoglobin, alpha 2 beta 2, this is known as hemoglobin A. That is major hemoglobin in human, in me, in you, in all the healthy individuals. This is the main hemoglobin. 95 to 98% of the hemoglobin is this one only. But